difficulties, but everything seems to be working now. My name is Kristen Helfer-Kester. I'm here with the VICAP program in Fairfax County, Virginia Insurance Counseling and Assistance Program. I'm the assistant coordinator for the program, and joining me over here is Mary DeLeon. She's the coordinator for our VICAP program. So before we get started, everyone should have a copy of the presentation. If anyone doesn't, please put your hand up and Mary can hand them out to you. I see there's a few people over here. And then the other thing, too, there was a sign-in sheet. People should have called to register, but if you didn't, we do have a sheet, if you don't mind, before you leave. Mary has the sheet. If you could sign your name and your zip code, that would be great. Okay, so we're going to follow along with the handout, but we also have it on PowerPoint here. So again, we're the Virginia Insurance Counseling and Assistance Program. We're located in Fairfax County across from the Government Center. So every county in Virginia has a VICAP program. Nationwide, we're known as SHIP, State Health Insurance and Assistance Program. So if you have friends or relatives that live in other states, they will have someone, a SHIP counselor, who can assist them if they have Medicare questions or issues. So Mary and I, as I mentioned, we're with the VICAP program. We're employed with them, and we serve approximately 160,000 Medicare beneficiaries in Fairfax County, just the two of us. And you know, that's very difficult, especially now during open enrollment. We're doing a lot of presentations. We're not in the office. But we do have about 12 volunteers who work with us, who answer the phones, who call people back and meet with individuals. And they're there Monday through Friday from 10 a.m. to 2 p.m. The average age for our volunteers is around, I believe, 72 years old. We have someone who is in his 80s who's been with us for over 20 years. And all our volunteers are fabulous. We truly value them. So if you happen to call our office, all that we ask is that you be kind to our volunteers. They're very helpful and knowledgeable individuals. So we get a little bit of money from Medicare or the federal government to provide free, objective information to individuals about Medicare. Now, some of you may have attended other Medicare presentations that were held maybe by an insurance company or insurance brokers. If you do that, we just ask you to be careful. Mary and I actually attended a few of them, and much of the information that was presented was incorrect. So in order for us to be VICAP counselors, we have to go through training and we have to take an annual test. We're providing you with correct, up-to-date information. That said, as volunteers, we don't make decisions for you. So for instance, if you're working or you're retired, we always ask that you check with your employer or former employer before you make any changes to your health insurance. So what is Medicare? Medicare is a $700 billion health insurance program for citizens or individuals who are legally here for at least 5 years, who are 65 years and older. And that's about 51 million people currently. Medicare is also eligible to people who are under the age of 65 who are collecting Social Security disability benefits. Those Medicare benefits for those individuals would start 2 years after their SSDI benefits start. People who have end-stage renal disease or kidney failure or Lou Gehrig's disease can start Medicare sooner. Medicare is an individual insurance plan. It's just for you. It's not group insurance. It's not self plus one. It's individual insurance. And it's administered by a federal agency called the Centers for Medicare and Medicaid Services, which is in the U.S. Department of Health and Human Services. So today, what we're basically going to go over is what's listed over here. I hope all of you can see this. But we're going to discuss the difference between traditional fee-for-service Medicare and a Medicare Advantage plan, which is also known as Part C. Those are managed care plans like HMOs and PPOs. So there's two different ways you can get your benefit, through traditional Medicare or through a Medicare Advantage plan. We're also going to talk about Part B. Some individuals, particularly those who worked for the federal government, who are eligible for the federal retiree health benefit plan, don't have to get Part B. But we'll talk about Part B. We'll talk about getting a good Part D prescription drug plan and how you can save money on Medigap insurance, which works with original Medicare. So again, we're going to talk about these key choices that you can make. Generally, if you make a bad choice, you can fix it during open enrollment, which is right now, October 15th through December 7th, except with one case, and that's Medigap, which we'll talk about later. The bad news is if you don't make some choices in a timely manner, you may have to pay late enrollment penalties. And we also encourage people to shop or review their choices every year. So if anyone currently has a Part D prescription drug plan or a Medicare Advantage plan, this is the time to shop and see if there's a less expensive plan for you available next year. For example, we had someone who was taking certain medications, had a Part D plan. She was spending about $80 a month for her prescriptions. And she didn't bother to look to see if there was a less expensive plan or to see if her plan actually made any changes. Sometimes the plan will change their formulary or they'll change the cost of the medications. And she ended up calling us in January or February last year. She actually ended up spending $800 a month because the plan had made changes to their formulary, and I bet what happened was some of her drugs weren't covered. So we always encourage people to please at least check. You can go on Medicare.gov. It doesn't take that long to do it. We have a tip sheet over here. Also, we're going to be conducting open enrollment events here at the mosque. In a few weeks after Thanksgiving, we have a sign-up sheet if anyone's interested. We're going to be scheduling individual appointments. Again, if you have a Part D prescription drug plan or a Medicare Advantage plan and you're interested in seeing if there's a better plan available for you next year, we're happy to meet with you one-on-one for an appointment. It's for 45 minutes, and Mary has that information. You can meet with her after the presentation. Okay, so the coverage basics, this is on the bottom of page, on the top of page 3. So again, Part A is the hospital insurance piece. This is financed through a payroll tax, and about 99% of the nation's hospitals accept Part A. I think there's a few hospitals in Texas that don't. Part B is the medical insurance piece. It's financed through the Part B monthly premiums and then also through general revenues, and about 89% of the nation's doctors accept Part B. Part C are Medicare Advantage plans. Again, those are managed care plans like HMOs and PPOs, and Part D is the prescription drug benefit. So just to repeat, there's 4 parts to Medicare. There's Part A, Part B, and Part D, prescription drug benefit, and then Part C, which is Medicare Advantage plans. Medicare Advantage plans manage a person's Part A and Part B benefit, and a lot of them do include the Part D prescription drug benefit. So another way to look at it is through this table thing that we have here. And you can see under option 1, this is one way you can get your Medicare benefit. You can have Part A and Part B. And what that means is when you go to the doctor under Original Medicare, you give them your Medicare card. You can sign up for a Part D plan and maybe a Medigap plan. And Medigap plans help cover out-of-pocket costs with Part A and Part B. Now, if you have retiree insurance, federal retiree insurance, or maybe another employer insurance, or maybe you have TRICARE for life, you may just want to enroll in Part A and Part B. Your retiree plan or TRICARE for Life is covering the prescription drug benefit, and they're covering the extra costs associated with Part A and Part B. The other way some people get their Medicare benefit is through a managed care plan, a Medicare Advantage Part C plan. Again, that plan manages your Part A and Part B benefit. You still have to enroll in both of those, and a lot of them do include prescription drug coverage. Yeah, right. The military, the federal open season has a different open enrollment period. The federal health marketplace has a different open enrollment period. So, yeah, for Medicare, if you already have Medicare, again, if you, I'm sorry, but you also have TRICARE? Yeah, so you don't, this doesn't, if you have a Part D, Medicare Part D plan or a Medicare Advantage plan, this is the time when you would make the changes. Yes, ma'am. Yeah, we'll talk about that later, but for those individuals who are federal retirees, your decision is whether or not to sign up for Part B. Your federal health insurance acts like a Medigap. It helps covering those out-of-pocket costs, and they include prescription drug coverage, so you wouldn't need a separate Part D plan. And for those individuals that do have TRICARE for Life or federal health insurance, I do have some information with me after the presentation. I'm happy to give it to you. Okay, so why are there so many parts? This is the top of page 4. Medicare started in 1965, so it's 53 years old. It is now often called traditional, original, or fee-for-service Medicare. Remember, that's one way you can get your Medicare benefit. The Part D prescription drug benefit was added in 2006, and this year there's 24 separate or individual Part D prescription drug plans available in Fairfax County. Next year there's going to be 27. With Part C, the Medicare Advantage plans, those started growing in the 1980s. It's a different way of getting your Medicare benefit than original Medicare. Again, Medicare Advantage is managed care plans like PPOs and HMOs that have a network of providers. Okay, we're going to go over that soon. Thank you. So just to repeat, we want to make sure you understand it. Again, there's 2 ways you can get your Medicare benefit. You can go through original traditional fee-for-service Medicare. It's traditional Medicare program that's administered through federal government contractors. If you have traditional fee-for-service Medicare, what that means again is that you take your Medicare card to the doctor or to the hospital. That's how you're getting your Medicare benefit. You have more flexibility with traditional Medicare. You can see any Medicare participating doctor nationwide that's accepting new patients. So if I go to Florida or if I'm vacationing out of state and I want to see a doctor that accepts Medicare, hopefully I won't have too difficult a time finding a doctor. With Medicare Advantage Part C, those are managed care plans like HMOs and PPOs that manage your Medicare benefit. For example, there's some companies, there's Aetna, United Healthcare, Innovation Health, they offer these Medicare Advantage plans. So for example, say I join the Aetna HMO Medicare Advantage plan. When I go to the doctor, I give them my Aetna card because Aetna is managing my Medicare benefit. But with the managed care or Medicare Advantage plan, I want to make sure I see doctors in network. If I'm in an HMO and I go outside of the network, I'm not going to have any coverage. If I see a doctor that doesn't accept that insurance, I'm going to have to pay 100% of that doctor's cost. So it's a little bit more restrictive. Okay, so let's go over the different parts of Medicare. So Part A is the hospital type stuff. Generally, people automatically get it at 65 at no charge, meaning no monthly premium. If they or their spouse earned it through 10 years of work, they've paid Social Security taxes. Again, those individuals would not have to pay a monthly premium for it. But if you haven't worked 40 quarters, there is a monthly premium. Come see us afterwards and we can talk to you about that. Part A helps to cover inpatient hospital stays, skilled nursing facility stays. What that means is that after I'm in the hospital as an inpatient for 3 nights or longer, my doctor may say, oh, you need rehabilitation in a skilled nursing facility. Part A would help to cover that. It also helps to cover hospice and home health. It is a good benefit, but there is a deductible. And the hospital first day deductible next year is going to be $1,364. So we have an example on the bottom of page 5. Say I have so much anxiety from giving this presentation, I have some chest pains, and I go to the emergency room, and they admit me as an inpatient. So the first day I'm there, I'm responsible for the first day hospital Part A deductible, which is $1,364. After that, I pay $0, but I'm discharged on day 4, and I'm out of the hospital for 60 days. And then on day 65, I have chest pains again. I go back to the hospital. I have to pay that hospital deductible again because 60 days have passed from the time I was discharged from the hospital. So this Part A hospital deductible is not an annual deductible. Again, it's based on a benefit period. So if I'm unlucky, I could pay that 5 times during the year. And a lot of people do have coverage for things like this. Maybe they have a Medigap plan or some other form of insurance that helps cover that. Okay, moving to the top of page 6, the Part B, the doctor type stuff. Part B is voluntary. You do not have to register or enroll in it, but a lot of people do because it does help to cover doctor's visits, lab work, outpatient care, things like that. The monthly premium this year, the average monthly premium is $134 a month. Next year it's going to be $135.50. If you have a higher income, you're going to pay more for your monthly Part B. If you have a lower income, you may pay less. If you don't sign up for Part B when you're first eligible, however, you could face a late enrollment penalty, and we'll talk about that later. So Part B covers 80% of most doctor bills, as I mentioned. You would be responsible for the 20% that Medicare doesn't cover. And a lot of times people ask us, do most doctors accept Medicare? We say, yes, they do, but you need to check to see if they accept assignment. So your assignment is to see if the doctors accept assignment. What that means is that they agree to be reimbursed according to the Medicare rate or the Medicare fee schedule. Now, we have heard of some specialists that don't take Medicare, maybe psychiatrists, or other types of specialists. They may not take any insurance, though. If that's the case, they may totally opt out of Medicare and have you sign something saying that they don't accept Medicare. In that situation, you would be responsible for the bill. There are also some cases, especially in this area, of doctors who have gone boutique or they're concierge, meaning they charge like $1,000 or $2,000 a year for you to be their patient. You still have to pay your Medicare premiums, but you're paying this additional amount for maybe the doctor to respond to you quicker or to respond to you via email. You don't have to sign up for those doctors, but that's what we've heard that's happening in this area. Yes, sir?
When a doctor doesn't take insurance,
Mm-hmm.
and you have to pay it, can you then ask Medicare to cover it or to reimburse you?
No, if a doctor totally opts out of Medicare, if they have you sign a form saying they don't accept Medicare, you cannot submit the claim to Medicare. The doctor won't submit it to Medicare. You're responsible 100% for the cost. But on the next slide, there are some doctors who are considered non-participating. So in this example, you can see that, let's say a doctor accepts assignment, and let's hypothetically say that the Medicare approved rate is $100. Well, Medicare is going to pay 80% of that, or $80, and then you pay 20%, or $20. But if you see a doctor that doesn't accept assignment, if they're non-participating, they can charge you 15% over the Medicare-approved rate. So in this example of $100, Medicare would still pay the 80% or $80. You're responsible for the 20% or $20, but then you have to pay an additional 15% or $15. So your total out-of-pocket would be $35. So there's three types of doctors in Medicare. You have doctors that accept assignment. You also have doctors that are considered non-participating. Maybe they accept assignment on some benefits or services, and maybe some they don't accept assignment. And then you have doctors that totally opt out of Medicare. Does that make sense? You have to ask your doctor, do you accept assignment? You want to see doctors that accept Medicare assignment. Yeah. Yes, they'll only charge what Medicare will pay. Or they may charge more, but Medicare is only going to pay them a certain amount. Yes, ma'am. They may still qualify, but they may have to pay a monthly premium. It's based on how long you've worked. If you've worked less than 2 years, you're going to pay a monthly premium for Part A. And it's if it's based on the number of quarters that you've worked, but it can be over. Yes. They'd have to pay for Part B too. Yeah, unfortunately. They may be eligible for financial assistance, which we'll go over later. There's some programs that are available.
Medicaid will pay.
Maybe Medicaid, right. There may be other programs, yes. Yes, ma'am. Okay, so you may have a monthly premium for insurance. You have to pay a certain amount each month. Like, for example, Part B, the standard Part B monthly premium is $134. For those individuals who are collecting Social Security retirement, they may have it taken out of their Social Security check. For others who don't collect Social Security retirement, they would have to pay that. It's a monthly premium. And then a deductible is something that you pay the total deductible before you receive any benefits. So again, for Part A, there is a $1,364 deductible. You pay that first, and then you're eligible for services or benefits after making that payment. Well, for the hospital, there is a deductible, and again, that's not an annual deductible. For Part B, there is an annual deductible, which I'll go over. There's deductibles with Part A, with Part B, with the prescription drug benefit, you may have a deductible as well. It starts all over in January of the next year. It starts over, yes. So the gentleman has a question about Medicare and secondary insurance through his employer. And you pay a monthly premium for that?
They take it from my retirement.
Right, so you have it through the employer, and yes, you're paying a monthly premium for that insurance. Yeah.
I'm charged $20 all the time.
When you go to the doctor? Yes, that's set up through your plan. Each plan has different co-pays, and a copay is what you'd pay when you, for example, if you go to the doctor, it's a flat dollar amount, maybe $20, $50. Co-insurance would be a percentage, like 20% with Part B. Medicare pays 80%, you're responsible for 20% of the cost. Okay, why don't we go to the next slide? We'll go over prescription drugs now. This is the top of page 7. Part D, D stands for drugs, that's easy. Prescription drug or the Part D benefit is voluntary. These companies, the plans that run it are private for-profit companies. You can shop for the plans on Medicare.gov. Again, next year there's going to be 27 different plans. You want to find a plan that covers your medicine, meaning all drugs are on the plan's formulary, and you want to see if there's any restrictions. Currently, there's 3 ways that a plan can impose restrictions. There may be a prior authorization requirement. There may be quantity limits on medication. And there could also be something called step therapy, What that means is that with step therapy, the doctor or the plan may require you to try a cheaper, less expensive drug before they'll allow the brand name drug to be dispensed. Okay, so the Part D benefit started in 2006. It was a little weak. There was a donut hole, which I'm sure a lot of you heard of. And at that time, you had to pay $3,760 when you were in the donut hole. You did not have any coverage. The benefit is getting better. In 2020, the basic benefit will be about a $500 deductible. Then you're going to pay about $2,500 in drug cost. And if you make it out of that, if you pay that, then you'll owe 5% of a drug's cost. So 5%, while it doesn't seem like it would be that much, it can still be expensive. A lot of the new cancer drugs are $100,000 or more, so 5% of $100,000 is still going to be a lot of money. Some people may not spend that much. Maybe they're taking generics, and their generics are either $0 or maybe less than $10. So they may not spend much during the year. But those individuals who are taking more expensive drugs, like insulin, inhalers, those generally are more expensive. So you may end up spending more money. Okay. At the bottom of page 7, this is an example that we put together, and I know it's complicated, but this is how the Part D benefit is going to look next year, whether you're enrolled in a Part D prescription drug plan, or maybe you get your Part D benefit through a Medicare Advantage plan. Your plan may have a deductible. Next year it can be up to $415. Again, what that means is that when you have a deductible, you're going to pay the full amount of your medication, the full cost of your medication generally, until you reach that deductible. You may not reach the deductible because maybe your medicine is not that expensive, but maybe you do. If you do reach the deductible, then you're going to go into the next phase, which is the initial coverage limit. Generally, at that time, when you're in the initial coverage limit, you pay about 25% of the cost of your medication, and the plan pays 75%. Again, if your drugs are expensive, you may then go to the next phase, which is the coverage gap or the donut hole. Next year, when you're in the donut hole, you're going to spend 25% for brand name drugs and 37% for generics. And if your drugs are expensive, you may go into catastrophic, and at that point, you're going to pay about 5%. So generally, you start out paying, around 25% for the cost of your medication. It may go down when you're in the donut hole, or it may go up, depending on the cost of your medication. And then if you do reach catastrophic, it may go down if you're only paying 5%. Again, but it depends on the cost of the medication. They may be more expensive, so they may be in a higher tier. So like the newer medications may be a tier 5 if there's no generic equivalent, and it may be very expensive.
10 or 20% or 100%?
That you'd have to pay? Well, it depends on what level you're in. If you're in the initial coverage level, you're spending 25% of the cost of the drug. You'd pay 5% of the cost of the medication.
No matter what the tier is.
Yes. Yeah. Right, we'll go over that. There are some programs available to people who have lower incomes and assets to help them with Medicare costs. Okay, so moving on to Part C. Again, this is another way that some people can get their Medicare benefit. These are managed care plans. This is also something that's voluntary. You can shop for these plans on Medicare.gov during open enrollment. You would pay a monthly premium. The premium in Fairfax County for the plans ranges from $0. There's one plan that's Innovation Health, HMO, that has a $0 monthly premium, and it ranges up to $142 a month. That's for a Kaiser plan. We're not just looking at the monthly premiums, though. We're looking at the estimated overall cost, and this also applies to Part D plans. When you're looking on Medicare.gov, please don't look just at the monthly premium. You want to look at the overall cost, because you may enroll, for example, in a Part D plan that has a low monthly premium, but maybe your drugs aren't covered on that plan's formulary, and you're going to end up spending more per year under that plan than what you would have spent on another plan that maybe cost you a few more dollars per month. So with Part C managed care, again, those plans manage your Part A and your Part B benefit, and a lot of them do include prescription drug coverage. So for example, if I'm in an Aetna plan, I go to a doctor that accepts the Aetna Medicare Advantage plan. The Aetna plan is managing my Medicare benefit. So how do they work? Again, you pay a premium, you get the Part A, Part B, and hopefully Part D services through the plan. You want to use doctors and hospitals that accept that insurance. So when somebody calls us who says they're interested in a Medicare Advantage plan, the first thing we say to them is to talk to your doctor's office, ask them which Medicare Advantage plans do they accept. If you want to continue seeing your doctor, ask them if they accept any Medicare Advantage plans. If they don't, then you need to decide if that's what you want to do. The benefits for Medicare Advantage plans, as well as the cost sharing, may differ from original Medicare. For example, these plans may offer dental benefits, they may offer some vision benefits. Original Medicare doesn't cover dental or basic vision or hearing, so these plans may offer those benefits. Also, there were regulation that passed this year that specified that these plans can offer even more benefits, like maybe putting handrails on staircases or offering transportation. These plans also offer catastrophic protection, a limit on total out-of-pocket cost. However, that said, if you have a Medigap policy, that would serve the same thing if you have original Medicare. If you're in a Medicare Advantage plan, you still are in the Medicare program and you still have rights and protections. Just remember again, the difference between original Medicare and the Advantage plans. With original Medicare, you have the flexibility to see any doctor that accepts Medicare in the country. So if I'm traveling out of state, it may be easier for me to see a doctor with original Medicare than with an Advantage plan. If I'm in an Advantage plan, I'm limited to the region that they serve. So when I go to Florida, I may not be able to see a doctor who accepts my insurance in Florida. Or if I travel somewhere else, I may not be able to see a doctor. However, if I need emergency room care, all the Medicare Advantage plans do have to cover that. Are there any questions about that? Oh, it went back to the beginning. We can talk to you about that. You can go on Medicare.gov's website, and we have a tip sheet, but we can talk to you about that after the presentation. Okay, so moving on, we're going to talk about Medigap now. And Medigap works with original Medicare. So if you have original Medicare, Part A and Part B, meaning when you go to the doctor, you use your Medicare card, there's out-of-pocket costs associated. There's deductibles, there's co-insurance, there's co-payments. You may want to pick up a Medigap plan. These are optional private insurance policies. Again, they help cover the deductibles, co-pays, and other things that Medicare doesn't pay for. Basically, they're filling in the financial gaps in Medicare. They do not include prescription drug coverage. They're just covering the gaps. Medigap covers the gaps or those out-of-pocket costs associated with original Medicare. These plans are heavily regulated by the federal government and also by our state's Bureau of Insurance. We do have I don't have it with me here, but we have a listing of all the different Medigap companies available in the state. The Bureau of Insurance puts out a quarterly listing by age, and so you can look up plans and you can get an estimate of the average or the annual cost of each of the plans. So for individuals who don't have extra coverage through maybe a former employer or a union, we would encourage you to look at Medigap. The cost is about $100 or more per month for someone at the age of 65, but it can vary based on the plan that you pick. There's 10 different Medigap plans, and also your age. And generally, the cost of the plans go up about 3% a year. But this is a good place for you to shop around when you're new to Medigap. When you first enroll in Part B, you can look at the Medigap policies and see what's available. So oftentimes there's confusion between Medicare Advantage and Medigap. These are separate policies. They're not the same thing. They're totally different. You cannot have Medigap and Medicare Advantage at the same time. So just please be careful, because we've had some situations where people called us and they called an insurance company wanting to buy a Medigap, where instead they were sold a Medicare Advantage plan. So when you do call them, you have to be very specific and say, I'm interested in enrolling in this particular Medigap policy. Well, if you qualify for Medicaid, which is a program for individuals who have lower income and assets, then you wouldn't be responsible for those out-of-pocket costs. I guess it does kind of act like that. You wouldn't need, if you have Medicaid, you wouldn't need a Medigap policy. The new Medicaid program? No, no, the expanded Medicaid program is for individuals who do not qualify for Medicare. So if you're eligible for Medicare, you're not eligible for the expanded Medicaid. Okay, so moving on. So the numbers that I use in our presentation are generally for people who are in the middle income level. But if you're among the 27% and over, living on less than $18,210 or $24,690 for a couple, you don't have a lot of liquid assets, meaning investments, bonds, things like that. There is help with Medicare's premiums and cost, and one of the ones is Medicaid, which we mentioned. There's other programs. There's something called Medicare Savings Program, which you might be able to get help, say, with your Part B premium and maybe other costs. And there's another program called Extra Help with Prescription Drug Costs. I do have some information over here on the table. Please take that. But if you know someone who may be eligible, please let them know about our program. Have them give us a call. There's about 14,000 people living in Fairfax County who are eligible for these assistance programs and are not receiving assistance. So we want to try and help these individuals out. For people who have a higher income, if you're among the 7% making more than $85,000 for an individual or $170,000 in joint returns, then your Part B and your Part D monthly premium may be higher. In those instances, Social Security is looking at your modified adjusted gross income from 2 years ago. So if you're retiring and your income is changing, there is a form that you can submit to Social Security. I did bring it with me. Please see me afterwards, and I'd be happy to give that to you. Okay, so this is on top of page 11, the new schedule for Part B and Part D premiums starting in 2019. Again, the average monthly Part B premium is $135.50. At that cost, you're only paying 25% of the actual Part B premium. Okay, the actual Part B premium will be $536, but you're only paying 25% of that. Again, if you have a higher income, you're going to pay more for Part B and Part D. All right, so we talked about what Part A and what Part B covers, but there's a lot of things that Medicare doesn't cover. I had mentioned it doesn't cover dental, hearing aids, normal eye care, but it does cover cataract surgery. It also doesn't cover foreign travel. You can buy private dental insurance or vision insurance. We do have a listing of dental and vision plans or companies that offer that type of insurance back at the office. So if you'd like that, we'd be happy to send it to you later. The biggest omission, or one thing that Medicare doesn't cover, which is extremely expensive, is personal care. It doesn't cover custodial, non-skilled nursing home care or assisted living or Alzheimer's type of care. And that can be extremely expensive. So a year in a home can cost more than $60,000. In a skilled nursing facility, it can be over $120,000. So we have an example on the next page, on the top of page 12. There was a story in the New York Times about a couple years ago that looked at 3 families where one person was dying of cancer, someone was dying from heart disease, and another person was dying from Alzheimer's. And the cost per year, cost over 5 years was $170,000 for the cancer and heart patient, and for the Alzheimer's patient, it was $270,000. Medicare paid $100,000 in each of those situations. So the beneficiary out of pocket had to pay $70,000 for cancer, for the cancer and heart treatment. For the individual who had Alzheimer's, they were paying $170,000. So it's extremely expensive. We encourage people to try to plan ahead if they can. Some individuals may have long-term care insurance, which will help cover personal care. Some people who have lower income and assets may qualify for Medicaid, which would help cover personal care in that situation. But if you don't qualify for Medicaid, some people may actually spend down their income or their assets in order to qualify to pay for it. I'm not a Medicaid representative, but some people may spend down their assets. They have so much money in assets, say they have like $20,000 or something like that, and they spend that money on their nursing home care, and then at some point they may qualify for Medicaid assistance. So just to review again, the basics: Part A is hospital, Part B is doctors, Part C is managed care. It helps manage your Part A and Part B and hopefully Part D benefit. You can't have both a Medicare Advantage plan and a Medigap policy. Part D is for drugs, and then there's Medigap and Medicare supplemental policies. If you have lower income, you may be eligible for assistance. If you have a higher income, you're going to pay higher premiums. There are some things that Medicare doesn't cover. And again, just to go over your choices, whenever you first start Medicare, you have to decide, how do you want to receive your Medicare benefit? Do you want to have it original Medicare or traditional Medicare? Then you may want to enroll in Part A and Part B and a Part D plan. If you don't have retiree coverage, you may want to pick up a Medigap policy. Or you could go with a Medicare Advantage plan. You have to enroll in Part A and Part B if you're going to enroll in a Medicare Advantage plan, and we'd encourage you to buy one that does include prescription drug coverage. So just bear in mind, with very few exceptions, with Medigap, which I'm going to go over, it's hard to switch Medigap policies. Once you pick Medigap, a Medigap plan, once you enroll in a Medigap policy, you generally stay with that plan forever, or plan to. Again, just to go over, these are your key Medicare coverage choices. And again, we want to make sure that you really understand there's two options for Medicare. So on the top of page 15, there's some pros or advantages to choosing either traditional fee-for-service Medicare or a managed care Medicare Advantage plan. If you have traditional fee-for-service Medicare, you have freedom of choice to see any doctor or hospital that takes Medicare anywhere in the U.S. So for example, in my family, we have a history of heart disease. Maybe I want to see a doctor at the Cleveland Clinic. It's going to be much easier for me if I have original Medicare to find a doctor that accepts that at the Cleveland Clinic. I bet that a doctor wouldn't accept one of our Medicare Advantage plans at the Cleveland Clinic. It's easier to travel domestically and find care. Again, if I'm vacationing somewhere out of state or I'm traveling somewhere, hopefully I won't have a difficult time finding a Medicare doctor. And I can seek out the nation's finest doctors on hospitals. With the Medicare Advantage plan, it may be simpler. You're picking one plan that's managing your Medicare benefit, and it includes drug coverage. You'll probably have a lower monthly premium with the Medicare Advantage plan compared to a Medigap and a Part D plan. And these Medicare Advantage plans do offer catastrophic protections. What that means is that, say I am hospitalized for a month or more and I'm seeing many specialists, I have a lot of medical costs. With the Advantage plan, there's a limit per year on how much you spend on health care. I believe it's around $6,400. So if I spend that amount or more in health care expenses, the plan's going to cover me for the rest of the year. I won't have to pay anything. There are some disadvantages, though. With traditional Medicare, it may be more expensive, as I mentioned. The care may be uncoordinated. Maybe I'm seeing one specialist here, and then I'm going to see this other specialist, and they're not talking to each other. With the Advantage plans, I may not be able to see that best doctor for my for whatever ailment I have. Maybe I want to go to Hopkins, but that doctor doesn't accept my Medicare Advantage plan. So that's a restriction. Your doctor may not be in the plan as well. And if you travel outside of your plan service area, you may not be able to get care. Again, unless it's an emergency. Bill, who normally does this study, references references a study that was conducted by Marcia Gold, where she did a meta-analysis of different research papers. And what she found is that as we get older, we tend to use more services, we want more benefits, and managed care can feel like it's rationing. It may not be Medicare Advantage, it may be a disadvantage to some people. And what we generally tell people, if you feel that you're going to be healthy, when you're 100 years old, you're going to die in your sleep, then maybe a Medicare Advantage plan is the best thing for you. But if you feel that you want to see whichever doctor is the best for your care, if you want to see certain specialists, then maybe you do want to go with original Medicare. Okay, if you do decide to go with Medicare Advantage, please pick one that does cover prescription drugs. There are some plans that don't, but we would encourage you to pick one. You want to have drug coverage. If you don't have drug coverage, you can be subject to a late enrollment penalty for Part D. You also want to check and see that your doctors and hospitals are included in the network of providers. So before you enroll, call your doctor's office and ask them, which Medicare Advantage plans do you accept? We also encourage people to look at the star rating, and this also applies to the Part D plans. We generally say 3.5 or 3 stars. There are some plans next year. There's actually one plan available next year that has 1.5 stars. It's a Part D plan, and I don't know how that plan is allowed to be on the market. That's terrible. It has really low customer service ratings. So look at the stars. Look at how it's rated. One other thing, I know we're talking about Medicare Advantage plans. In Fairfax County, we have 3 Kaiser plans, and those fall under the umbrella of Medicare Advantage, meaning you'd want to see doctors in that network. But these Kaiser plans are considered cost plans, and what that means is that you can go outside of the Kaiser network using your Medicare card to see doctors. This is the only Medicare Advantage plan where you can do that. It's the Kaiser plan. Again, if you want to see a specialist, say at Hopkins or somewhere else, you can use your Medicare card to do so. However, Medicare will pay the 80%, say, if you saw a doctor. You're responsible for the 20%. You won't have coverage for that. Kaiser would not cover that. But that is an option. And I know, again, Bill, who normally does this presentation, mentions that if you have the opportunity to go to a Kaiser presentation, you may want to check it out. Okay, so getting on to Part B issues. So when you do decide to enroll in Medicare and it's time for you to sign up for Part B, when you turn 65, this is at the top of page 17, let's look down the middle column. If you're still working when you turn 65, and if you're working for a company with 20 or more employees, and because of your work, you have health insurance, you're actively working and you have health insurance through your employer, you can delay enrolling in Part B. You don't need to enroll and pay the $134 or $135 a month. Again, as long as you or your spouse is actively working and you have group health insurance through that employer, you can delay enrolling in Part B. You can save that monthly Part B cost. When you do retire or whenever you stop working, though, you want to sign up for Part B within 8 months. You have an 8-month window to enroll. You can still enroll in Part B when you're working, but again, if you want to delay that, just make sure you sign up within 8 months of your employment ending to avoid a penalty, a late enrollment penalty. Also, you only have 2 months, though, to enroll in a prescription drug plan. So you don't want to go more than 2 months without credible prescription drug coverage. Yes, sir. Yes, it's a penalty that will last the rest of your life unless you qualify for financial. Every month. Every month, yes. October 15th through December 7th is the open enrollment period. So if you have Medicare currently, you can switch your Part D prescription drug plan, or if you're in a Medicare Advantage plan, you could switch to another Advantage plan if you wanted to. You can make some other changes during that time as well. And then on the left of that page where it says you're retired, if you're retired, you don't have insurance, or if you have poor insurance, we encourage you to enroll in Medicare, again, around the time you turn 65. You have a 7-month window. It's called your initial enrollment period. So you can apply 3 months prior to your 65th birth month. The 4th month of that initial enrollment period is when you turn 65 that month, and then 3 months after. Again, you have a 7-month window to enroll in Medicare around your 65th birthday. So if you don't have any insurance, or maybe you have insurance through the federal marketplace, you have an individual policy, this would be the time to enroll. Right, so the question is, if you're enrolling 3 months prior to your 65th birth month, would you enroll in everything like Part A and Part B and a Part D and a Medigap policy? Yes, you can do that. You would enroll in Part A and Part B first, and I'll go over this later, but the easiest way to enroll is on Social Security's website. When you're first enrolling, you go on ssa.gov, and you can enroll in Part A and Part B that way. But say I'm working and I don't want to enroll in Part B at that time because I have health insurance through my current employer, I can still just enroll in Part A on Social Security's website. But you would do that first, and then you can sign up for a Medigap policy and a Part D plan, and they would all start on the first day of your birth month. Okay, and someone had mentioned about the late enrollment penalty. If you don't sign up when you're supposed to for Part B, and maybe you're not eligible for a special enrollment period because you're not working, you could face a lifetime 10% increase in premium. So for every 12-month window you go without Part B when you should have enrolled, there's a 10% penalty. And you would have that forever. Okay, then on the right side, if you're retired and your employer offers good insurance, maybe you're a federal retiree. If you're a federal retiree, your decision is, do you want to sign up for Part B? You may be subject to the higher monthly premium costs for Part B, so that's something you want to think about. If you do, you can enroll in Part B, and then you'll have full coverage. There's some federal plans that do work with Medicare, and they'll waive their copays and deductibles and things like that if you have Part B. If you don't join Part B, then you're going to save about $135 a month. Okay, but whatever you do, if you're working, we encourage you to talk to your company's human resources or benefits department before you make any changes. Now, if you work for a small employer, for an employer with less than 20 employees, then you should sign up for Medicare, because Medicare would pay first. If you have a health savings account or COBRA, please come see us afterwards. Those are special situations. They're a little different. We do have some handouts we'd be happy to give to you. Okay, moving on to Part D. Okay, so Part D drug coverage is at the top of page 18. As we mentioned earlier, some medicines, some prescription drugs are really expensive. Even if you're not taking any prescriptions at this time and you're ready to sign up for Medicare, we encourage you to enroll in a Part D prescription drug plan. Please have that coverage. You just never know when you may need it. We have an example that we tell at these presentations where someone called our office one day. She lives in Reston, and she was taking her trash out one day, and a copperhead snake bit her. So, how often does that happen? She went to the Reston hospital, and she had to get anti-venom injections. She had to get 6 injections. Can anyone guess how much it costs to have 6 injections of anti-venom? And anti-venom is nothing new, It's not a new treatment. Does anyone know how much that would cost? Okay. It was $172,000. And thankfully, she had insurance that covered it. But what if she didn't? These are things you just never know that could happen. So again, if you don't take any prescriptions, in that case, we would tell you to look at the lowest cost monthly premium drug plan, which next year I believe is going to be around $14, $15 a month. You would sign up for Part D, again, around the time you turn 65 if you don't have credible coverage, meaning coverage as good as Medicare, say through your employer if you're actively working. But remember, you have that 2-month window. Once you stop working or your health insurance ends, you want to pick up Part D coverage. And we do have a tip sheet again on you can look up plans on Medicare.gov. It's really easy to do so. If you need assistance from us, we're happy to help you. Again, we're taking appointments if you want to meet one-on-one with us. In a few weeks, we're happy to help you with that. We ask you that you enter your drugs on the drug finder. Look at the formulary. Are your drugs covered? Is the pharmacy near you in the plan? Is it considered a preferred pharmacy? Preferred pharmacies may have lower costs for your medications. Look for higher star ratings and also shop each year. About 85% of us can save about $350 a year just by switching drug plans. You don't have to keep the same drug plan every year. It's okay to switch. Okay, and then moving back to Medigap. If you want to pick up a Medigap policy, again, those work with traditional fee-for-service Medicare. They help to cover the out-of-pocket costs associated with Part A and Part B. Now, on the bottom of page 19, on this chart, you can see there's 10 different Medigap policies. They're labeled A as in Apple through N as in Nancy, and they provide different levels of coverage. So the F as in Frank policy provides the most coverage for those out-of-pocket costs associated with Medicare. However, with the Plan Fs, starting in a few years, in the year 2020, new Medicare beneficiaries, meaning people who are turning 65, will not be able to enroll in the F or the C policies. People that already have them will be grandfathered. They can keep them. But when we're talking to someone who's new to Medicare, we're talking to them about other types of plans, maybe a G policy. The G policy is similar to the F. The only difference is it doesn't cover the annual Part B deductible, so you would be responsible for that. But even that said, the G policies can be cheaper than an F, even when you factor in the $185 annual deductible for Part B next year. So look at the G policies. I've talked to some people who also have N, but this is a big decision that you have to make. Carefully study that chart and think about which Medigap plan, think about how you'd like to get your Medicare benefit. Not now when you're healthy. Think about 20, 30 years from now. What type of benefit would you like? Again, with Medigap, once you pick it, you're going to keep it probably forever. It's hard to switch Medigap policies. If you're healthy, you may not have any problems, but what's going to happen is after you turn on Part B, you have a 6-month window to enroll in Medigap where the companies have to offer you a Medigap policy. If you miss that 6-month window, then the Medigap companies can medically underwrite you, meaning they can ask you about pre-existing conditions, about your health status, and they can say, well, no, you had cancer, I'm not going to offer you a policy. Or maybe they could say if you had something that was minor, they may offer you a policy, but they may charge you more than someone else your age. So again, there's 10 different plans, and we have a listing back at the office of all the different companies that offer Medigap policies in Virginia, but you can also go on the Virginia Bureau of Insurance website. They do have that information on their website as well. And here's the web address for that. So another thing to keep in mind is when you're looking at the Medigap policies, say I do want to go with the G policy. Every company that sells a G policy has to cover the same things. The only difference is what they charge you. So the most expensive G policy is no different than the least expensive policy. Yes, sir?
They never cover anything more than anybody else.
No, they have to, if every company that offers the G policy has to cover the same thing. So that's just something to keep in mind. You can shop based on the cost. You can also talk to friends, relatives, and ask them what their experience has been with Medigap if they have it. But this is just a quiz that we have here that, say somebody decides to buy a Plan G to help cover some of her costs, and she found 2 companies in her area that offer the plan. One costs $153.50 a month, and the other one is $186. And she's really concerned about the cost. So should she buy the cheaper one? What's the answer? A? That's right. She can go ahead and buy the cheaper one. There's no difference in the benefits. Again, they have to cover the same thing. She can go with the less expensive plan if she wants to. And this on top of page 21 is just an estimate of the premium cost per month if you went with traditional or fee-for-service Medicare compared to a Medicare Advantage plan. Again, this is just, it's a rough estimate. I would encourage you to, if you're interested in one option or the other, is to look at the different types of Medigap policies, see which one you'd be interested in. You can go on Medicare.gov and look up Part D and Medicare Advantage plan to get a cost estimate that way too. The next slide just gives you a summary of choices to make. Just bear in mind, when you are eligible for Medicare, please sign up because you want to avoid the late enrollment penalty. Applying for Medicare, we talked about this earlier, you can apply 3 months before you're 65. If you're working though, if you're actively working and you have health insurance through a job, you can delay enrolling in Part B. Go ahead and take Part A though, you're not paying a monthly premium for it, so why not? To do that, contact the Social Security Administration. If you're already collecting Social Security retirement benefits when you turn 65 or disability benefits, you will be automatically enrolled in Part A and Part B. You'll get your card in the mail. You don't have to apply. We talked about the initial enrollment period, the 7 months starting 3 months before you turn 65. The 4th month is when you turn 65, and then 3 months after. If you miss your initial enrollment period and you're not eligible for a special enrollment period, the only time you can apply for Medicare A and B, or for Part B generally, is during what's called a general enrollment period. That's every January through March. You'd have to go to Social Security to apply. Again, if you miss the initial enrollment period and you're not eligible for a special enrollment period, you can apply during the general enrollment period. If you apply then your Part B will not start until July of that year, and you may be subject to a late enrollment penalty. If you're turning 65, right, and you don't have insurance through a job, say, you can apply 3 months prior to when you turn 65. Yeah, that's the earliest when you can apply. You only have they don't have Part A, and we can talk about that after. Yeah, if you have to apply for Part A, you have Part B, but you don't have Part A. If you want to apply for Part A, it would have to be during the general enrollment period, maybe. But it may be based on your situation. We'll have to talk about that. Again, you can delay enrolling in Part B without penalty if you're covered under a current active employer, or you have a group health plan through that employer. You'd want to sign up within 8 months of that employer insurance ending, or within 63 days to sign up for Part D. Now, COBRA doesn't count as a special enrollment period. Again, once you stop working or your spouse stops working, you want to sign up within 8 months for Part B, within 63 days for Part D. Some last points. Please help fight fraud. There's so many scams going on. People calling, there's like the grandparent scam, there's other things going on. The federal government will not call you, Medicare will not call you, the IRS will not call you. Just hang up the phone. Don't listen to whoever's calling you. We do have some information on the table over here from Senior Medicare Patrol. They help to educate people on Medicare fraud and abuse, and they actually have a personal health care journal where, for instance, if you go to the doctor, you can write down the date you go to the doctor, what doctor you see, what services you received, and then whenever you get your Medicare summary notice or explanation of benefits, you can compare them. Sometimes you may be double charged or double billed for something, or there may be a charge on there, say, for like an MRI and you didn't have it done. In that case, you can call your doctor's office. Maybe they made a mistake, but if you think there's some fraud or there's something sketchy going on, you can reach out to Senior Medicare Patrol and report it to them. Also, be careful if you're in a managed care plan if you are working and you're in a managed care plan, you may be what's called seamlessly converted to an employer Medicare Advantage plan. We have heard of that happening. Say I'm working and I'm in my employer's managed care plan, and then I go to enroll in Medigap, but the employer plan puts me in their Medicare Advantage plan without telling me. Okay, and then also be aware of observation status. Sometimes you may go to the hospital and the doctor may say, oh, I'm not going to formally admit you. I think maybe there's just, it's nothing major. I just want to put you in observation status. When you're in observation status, you're not eligible or Medicare will not cover, like for instance, if you need to get skilled care after being in the hospital. We had a situation where a woman who had gone to the hospital, she was unconscious. She wasn't formally admitted. She was in observation care. She was there for a week. She had surgery. I think she broke her hip. And then she went to skilled care for rehab. 2 months after being in the skilled care facility, the nursing administrator had come to her and said, oh, I see you weren't formally admitted. You weren't admitted as an inpatient. You have to pay us $30,000. So again, if you go to the hospital, we encourage people to advocate on behalf of others. If you're an inpatient, if you're admitted as an inpatient and you're there for 3 nights or longer, the doctor may say that you need rehabilitation in a skilled nursing facility. Medicare Part A would help cover that skilled nursing facility care. But if you're in observation care, that's covered under Part B, Medicare Part B. So if you go for skilled care after being in the hospital for observation care, Medicare is not going to cover anything. So please just be mindful of that. That does happen. And also, just pay attention to congressional budget debates about how it's affecting Medicare. Okay, are there any questions? Yes, ma'am. We have information I can share with you. The question was about how much you might owe for Part B, and I have some information I can share with you about that. If you already have Medicare, you can switch what you have. Like if you're in a Part D plan and you want to see if there's a less expensive plan available that covers your medicine, you can switch then. There's other things you can do during open enrollment, but generally that's what it applies to. Yeah, if you do nothing, it will stay the same, but we encourage you to at least look and see what changes your plan has made, because there may be some significant changes. They may not cover your certain prescriptions, or maybe the copays going up. You need to be aware of that. It's the Bureau of Insurance, and we can give you that. I have the booklets back at the office. I'm happy to send that to you. It's that chart that you have. It's on one of the slides. It goes over the 10 different types of Medigap policies and what they cover. Well, the question was about having Medicare and working, and whether you have a full-time job or a part-time job. It doesn't matter. It's the fact that you have health insurance through that employer.
No, it is not.
If you don't have health insurance through that employer, no, that doesn't count then. Then you'd want to sign up for Medicare. Yeah.
Thank you.
Mm-hmm. All right, thank you so much. We'll be here. Mary and I will be here for questions afterwards. Thank you so much. Thank you for your hospitality.